Hello, good morning. Well, morning here on the East Coast of the United States. My name is Dr. Joy Scheidell. I am an assistant professor at the University of Central Florida, and I'm going to be presenting some work that I and my colleagues have been doing regarding racial and ethnic differences in sexual and reproductive health needs and services for women who use illicit opioids in New York City. Previously to coming back to the state of Florida, I was faculty at NYU Grossman School of Medicine, where this work was conducted. So let me see. Okay. And so I would first like to acknowledge my collaborators, Doctors Alex Bennett and Luther Elliott, who were the principal investigators of the parent study that I will mention briefly when I go over the methods, and also the most amazing research coordinator, Nani Mahachi, and also acknowledge our funding sources, primarily from the National Institute on Drug Abuse, specifically the Center for Drug Use and HIV/HCV Research at NYU, who provided the pilot funding for this project. And so I'm just going to jump right in to why are we focusing on sexual and reproductive health care and conditions for people who use illicit opioids, specifically women. And we have seen that counter to both men who use drugs and women who don't use drugs, women who are using drugs, including illicit opioids, have an elevated risk of sexually transmitted infections or STIs, and also related adverse sexual and reproductive health conditions. And this is in part because certain STI-related risk factors, like transactional sex, multiple sexual partners, and sexual violence are prevalent among populations of women who use drugs. And alongside that, they frequently have substantial unmet need for sexual and reproductive health care. And we have seen harm reduction, specifically syringe service programs is what I'll be talking about today, play a really vital role in preventing infectious diseases, starting back in the day with really a focus on preventing HIV and HCV through the provision of sterile injection equipment. And subsequently, we've seen syringe service programs expand their roles. For example, currently they really are on the front lines of addressing the opioid overdose crisis through providing naloxone, fentanyl test strips, safe injection, et cetera. And so we've seen that they may also have a role to play in prevention of infectious diseases transmitted primarily through sexual contact, so STIs, as well as kind of the broader sexual and reproductive health conditions. And there's not really any systematic research documenting sort of what's provided at syringe service programs here in the United States, at least, but sort of based on the literature, it appears that the vast majority of syringe service programs are providing condoms and doing on-site HIV and hepatitis C testing. Some may provide on-site testing for other STIs like chlamydia or gonorrhea. And then it appears that relatively few are offering other on-site sexual and reproductive health services for women. And when we're considering the utility of syringe service programs to increase access to sexual and reproductive health care among women who use drugs, it's important to consider both the intersecting gender inequities and racial ethnic inequities that may be experienced when it comes to accessing these services. And so we've seen that women who use drugs are actually less likely to engage with a syringe service program compared to men who use drugs. And this is despite the fact that women often have kind of more adverse consequences related to substance use, greater sexual transmitted infection, and other bloodborne infectious disease risk. And it's important to consider that women of color may be even less likely to utilize a syringe service program. Here in the US, We have a lot of criminalization and stigma attached to substance use, and this may be disproportionately experienced by women of color who we have seen are targeted by the criminal legal system and penalized for substance use differently than their white counterparts. And so fear of police contact, fear of having engagement with child protective services if their drug use is disclosed may be more common among women of color, and hence they may be less likely to engage with a syringe service program. And so while we've seen that it may be a promising approach to integrate sexual and reproductive health services into syringe service programs to increase access to that care, it's potentially possible that the benefits may not be distributed equally across the racial ethnic groups of women who use drugs. And so our objective in this study was to examine the sexual and reproductive health needs and utilization of syringe service programs among women who use illicit opioids in New York City. And we specifically wanted to assess whether there were differences in those factors across the racial ethnic groups of women, here focusing on the most prevalent race ethnicities in the US and the ones that were most prevalent in our data, which are Black women, Hispanic Latino women, and white women. And so this is a pilot study that I'll be presenting data from. It was nested within a larger cohort study that was conducted by Doctors Bennett and Elliott in New York City. And in that study, what I'm going to refer to as being the parent study, they recruited a cohort of almost 600 people who use illicit opioids in New York City using respondent-driven sampling. And then they followed them for 24 months to measure. Basically, the aim of that study was to understand opioid-related risk and protective behaviors in response and in relation to overdose. So as that study was sort of winding down data collection, we conducted this pilot study where we invited participants of the parent study to complete a one-time brief online survey asking questions about their sexual and reproductive health care and conditions. And they could also, if they wanted to, opt in to be mailed an STI self-collection kit where we would mail them a vaginal swab if identified as female and a urine cup if they were males, and they could obtain the specimen themselves and send it to the laboratory to be tested for chlamydia and gonorrhea. And we provided a $20 incentive, US dollars, if they completed the survey. And so we had a common ID number that identified them both in the parent study data, which measured a lot of detailed information about their substance use, and we use that same ID number to link their data that measured sexual and reproductive health in our pilot study. And so from November of 2021 to August of 2022, we enrolled 120 participants in this pilot study. And today I'm specifically going to be focused on the 54 women that were in the sample. And so now I'm going to describe the results. The first set of results being, unfortunately, something that won't surprise us, which is that the women who use illicit opioids have complex social needs and substance use histories that we need to be considering. So in our sample, it was a bit older. The mean age was 46 years, although the range was from 20 to 66 years of age. And that was at the baseline of the parent study. And so I'm going to be presenting some data that were obtained in the parent study and then some data that were obtained in the pilot study. I'll try to call out when those are different sources. And so we see here among our 54 women that slightly more identified their race ethnicity as Hispanic Latina, about 41%, and then Black and white, about 30% of the sample. The majority slightly had a high school or graduate equivalency degree. 85% received their healthcare coverage, public insurance, Medicaid, and a little over a third reported that they lived with a romantic partner who also used opioids. Now, hopefully this isn't too hard to see. So now we're going to start disaggregating the data by race ethnicity, where the total sample, so among all 54 women, the prevalence or percentages are going to be the data in those sort of brownish bars, the kind of orangish bar are the data for white women, that goldenrod color, Black women, and then the lightest sort of yellow color being Hispanic Latino women. And one thing I want to note is that as I start going through these and kind of highlighting where it may look higher or lower in certain groups, this is an exploratory analysis. We weren't really focusing on hypothesis testing or kind of these traditional p-value of 0.05 levels of significance. So just bear that in mind, that this is truly very descriptive. And so we see about 40%, 30 to 40% were currently homeless, and about 80% had experienced incarceration in their lifetime. About a quarter reported symptoms indicative of post-traumatic stress disorder, and that was most commonly reported 27% of Hispanic Latino women. Kind of similarly, high prevalence of depression across the racial ethnic groups, but again appeared to be slightly higher for Hispanic Latino women. Anxiety was also very prevalent, but here slightly more prevalent, it appeared among white women. And then finally, looking at adverse childhood experiences before the age of 18, we created a cut point of 4 or more experiences in their lifetime, so things like abuse, neglect, etc. And we see that over half of the women reported that they had experienced 4 or more of those things in their childhood, and that was most common among Hispanic Latino women. And so these are substance use histories as measured at baseline of the parent study, and we saw injection drug use being more prevalent in the past 30 days as opposed to prescription opioid misuse, which was less commonly reported. We also assessed co-use of opioids in the same period as other substances, and we saw that a higher percentage of Black women reported co-use of opioids and alcohol, whereas more white women reported co-use of opioids and benzodiazepines, and then the highest percentage for opioid and co-use of other drugs was reported by Hispanic Latino women. And while 41% of the total sample reported they'd experienced an opioid overdose in their lifetime, that was much more commonly reported for white and Hispanic Latino women, over 50% compared to Black women. And then when we asked about experiences that might be indicative of an opioid overdose in the past 30 days, again, we kind of saw that that was more prevalent among white and to some degree Hispanic Latino women compared to Black women. And looking at meeting the criteria for severe opioid use disorder based on the Diagnostic and Statistical Manual, the vast majority of the sample met criteria that was indicative of severe opioid use disorder, slightly more prevalent among white women, but still high overall, whereas severe alcohol use disorder was much lower, but still occurring. And we also asked about having had someone help them inject drugs in the past 3 months. And about 40% of white women reported that that had occurred, compared to about 20 and 25% of Black and Hispanic women, respectively. And also a baseline of the parent study measured experiences with substance use treatment. The majority of the sample had been in treatment for opioid use disorder at some point in their lifetime, slightly lower for Black and Hispanic women compared to white. About 51% of white women had been treated with buprenorphine, where that was much lower, again, for Black and Hispanic women. but appeared to be pretty similar levels of treatment with methadone maintenance, whereas white women reported a much higher prevalence of having engaged in treatment in a 12-step program. But interestingly, when it came to currently being treated with medications for opioid use disorder, we observed the lowest prevalence among white women compared to the other racial ethnic groups. And about half of all women reported that they viewed substance use treatment as being extremely important. When it came to being trained to administer naloxone, the majority of white women had been trained, but only 50% of Black women and about 3/4 of Hispanic women had been trained to do so. And then at baseline of the parent study, visiting Syringe Service Program or an SSP in the past 3 months was much more frequently reported for white and Hispanic women compared to Black women. And so now focusing more on data that we measured regarding sexual and reproductive health in the pilot study, we saw a high burden of need regarding sexual and reproductive health. And so first looking at some sort of behavioral partnership factors, we observed that about 1/4 of the women had multiple, so 2 or more sexual partners in the past 12 months. And the majority of women reported that they had a main sexual partner, so someone like a boyfriend or a spouse in the past year. And substance use before or during sex was pretty common with main partners, as was that their main partner also used drugs, though that was somewhat less reported among Hispanic women. And we asked if they suspected that their partner had probably or definitely had an STI, and that was reported by about 20% of the women. And when it came to having had transactional sex partners in the past 12 months, that was reported by about 11% of the sample overall, but more frequently reported among white women compared to the other racial ethnic groups, those still low prevalence overall. And then when it came to those who had those types of partnerships, so dealing with small cell counts, which is important to bear in mind, we observed that all of the white and Hispanic women who had sex trade partners reported using drugs before or during sex with those partners. And some, about 1/3 overall, reporting that those partners also used drugs and had probably or definitely had an STI. And then casual partnerships, so not a main partner, not a transactional partner, but maybe like a one-night stand or something like that, was less commonly reported by about 15% of the women. And then again, among those who had that type of partnership, so small numbers here, high levels of using drugs before or during sex with those types of partners, and that those partners also use drugs. And we observed, again, what has unfortunately commonly been observed across samples of women who use drugs, which is a relatively high prevalence of sexual and relationship violence. So about 1/3 of women reported that they had been coerced to have sex, where about 40% reported that they had been physically forced to have sex in their lifetime. And over half of women reported having experienced violence from an intimate partner in their lifetime, and about 10% having experienced that in the past 12 months. And now turning to sort of sexually transmitted infection risk, about 1/3 of the sample reported that they had symptoms indicative potentially of an STI in the past year. So things like unusual discharge, pain, burning on urination, things like that. But only 13% had reported being tested for an STI, and that was more commonly reported for white women compared to the other racial ethnic groups. And very few had been diagnosed with an STI, although all of the diagnoses were among Black and Hispanic women. And so, again, very small numbers, but for those who were diagnosed, all of the Black women with an STI diagnosis received treatment, where only 50% of the women who were Hispanic Latina and diagnosed with an STI received treatment. The majority of participants were not using an effective method to prevent STI, um, and that was more commonly reported among Hispanic and Black women. And a low but similar percentage, about 14% of women, worried a lot or moderately about STI compared to other things in their lives. And when we had asked participants, did they want to receive an STI test kit that was provided as part of the study, about 40% asked to be sent one, and that was more frequently requested by white women compared to the other groups. And then again, now looking at sexual and reproductive health measured in the pilot study, about 17% of those sample reported that they had never had a pelvic exam, or their most recent one was more than 3 years ago. Similarly, high percentage of women not having or having been a long time since they had had a pap test or cervical cancer screening. And for those that had been screened, we asked about if they'd received an abnormal result, which was reported by about 20% of the sample overall, but more commonly reported among Black and Hispanic women. The white women group was the most commonly reporting having used emergency contraception, so things like Plan B, and about 40% of the sample had ever had an unintended pregnancy. And we asked about whether women might desire to become pregnant in the future, and over 40% of the white women in the sample reported that they did, and that was less frequently reported by Black and Hispanic women. And so, in terms of barriers to receiving sexual and reproductive health care, we were somewhat surprised to observe that very few women reported that they had experienced barriers to receiving care, and that was all reported by the Hispanic Latino women. About 50% of women had been unable to obtain feminine hygiene products. And about 40% of women reported that they thought that receiving sexual and reproductive health services at a syringe service program could help to reduce the stigma and poor treatment that they might receive from providers. But that was less commonly endorsed for the Black and Hispanic women. And the majority of women reported they'd be comfortable receiving sexual and reproductive health care from a clinic that was run by a syringe service program, but it looked as though Black women may be slightly less commonly endorsing that. And then last, we asked about the syringe service programs, sexual and reproductive health care that they may have accessed. And this is, again, the pilot study data, so slightly different in terms of having engaged with the syringe service program in the past 12 months, but similar trends as what we saw in the past 3 months reported at baseline of the parent study, which was about 40% overall, but fewer Black women reporting that. Those who had been to a syringe service program in the past 12 months, about 40% reported they'd received education related to pregnancy or safer sex. About a quarter reported pregnancy or infectious disease testing, though when we asked about the specific type of testing, the majority of that was HIV or hepatitis C testing. About 16% received some type of sexual and reproductive health screening. About 40% overall had received medications or supplies. That was more commonly reported by white women compared to Black and Latino women. And again, when we kind of disaggregated what those types of supplies or medications might have been, the vast majority was condoms. And about a quarter reported receiving referrals to other sexual and reproductive health services, but very few of the Hispanic Latina women reported receiving those. And so we feel that our results indicate that syringe service programs can certainly reach women with the greatest sexual and reproductive health needs. And so when we look, these are slightly different format of the figures, but these are the sexual risk behaviors by race, ethnicity among women who did and didn't visit a syringe service program. So starting from the left, where that dark bar is now the total sample, and then the orangish bar is white women, the kind of goldenrod is Black women, and then the lightest color is Hispanic Latina women. The sort of slashed bars are those who didn't or who did visit a syringe service program, and the solid colors are those who did not. And as we kind of look across this just briefly, we see that the highest prevalence of some of these indicators of sexual and reproductive health risk are observed regardless of race, ethnicity, for those who are visiting our syringe service programs. So highlighting that these programs can, by providing sexual and reproductive services, reach within the kind of broader population of women who use drugs, those who are at high risk. But something that's important to consider is the use of syringe service programs being more common among women who inject drugs, and are we missing women who use drugs but don't inject, particularly those in certain racial ethnic groups. And so here, this is the prevalence of having been to a syringe service program in the past 12 months among all the racial ethnic groups, and the total sample based on whether they injected drugs or not. And so what we see is that among the total sample of women, about 53% of those who injected drugs had been to a syringe service program in the past year, compared to about 19% who didn't inject drugs. And we kind of see that trend across the racial ethnic groups that, yes, more, I should say, women who inject drugs are engaging with a syringe service program, but not all. And when we look among those who don't inject, even fewer are accessing syringe service programs. And so it's important because, like we saw with the sexual and reproductive health risk behaviors for women accessing syringe service programs, they do appear to be a high-risk group. Here, we're seeing similar trends. Now the hashed bars represent those who have injected drugs in the past 30 days. And we see something similar in that it does appear across the racial ethnic groups overall, women who inject drugs do have higher risk of sexual and reproductive health risk behaviors, but that's not invariably true. We do still see, especially for multiple sexual partnerships, that there are high or similar prevalence for those who do and do not inject. When we look at sex trade, for example, we see that white women who did not inject drugs actually have a higher prevalence compared to white women who did. And so just an important note, I think that yes, women who inject drugs are potentially a specifically high-risk group who may then access syringe service programs more frequently, but we still see plenty of risk within women who don't inject and who may not be accessing syringe service programs in the same way. And so now just some things for consideration. So we saw that women who use drugs have a high burden of STI risk and other adverse sexual and reproductive health conditions, that women who are engaging with syringe service programs are a potentially especially high risk and priority population to be able to be reached through syringe service programs. But there's going to be some complexity that we need to consider in reaching all women, including women of color who may not inject drugs or utilize a syringe service program. And so, of course, we need to keep in mind that this was a small sample of people who use illicit opioids in New York City, may not be representative or generalizable. I think a really important note is we can't determine if they just didn't have those services available at the syringe service program our participants were accessing, or if they were available but not accessed. We've seen in pilot studies in Seattle, Philadelphia, that it's possible to feasibly and acceptably integrate sexual and reproductive health services, but more research is needed. Can we do this in other locales? And would integrating them perpetuate or reduce stigma? So thank you very much. I see I did not leave that much time for questions, but I will welcome any questions if there are any. Okay, well, I think then if there are no questions, I was just very thorough. Well, my email is there if anyone wants to follow up. Thank you so much for your time.